morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Good morning. Welcome back to Insurance Matchmaking. Got something I think kind of came up, some things that have come up this week that kind of prompted me to think about this subject. And I know I've touched on it. Everything I've touched at one point or another. But kind of what we're hitting on right now is the different age gap that we run into between people going on Medicare and have a spouse. So that the spousal age gap is what I'm talking about. And sometimes that can be 15 years. I've got some people that are I get one couple come in and it's a 6-month thing. It's not a big deal. I usually kind of take care of both at the same time when it comes to Medicare. The other issue is when it's more than 6 months, whether it's a year or 5 years or 15 years, it makes a big difference. So those are some things I kind of want to touch on today. I do kind of want to bring you up to date. This is going to be probably a couple of weeks from the event of it, but if you live in Cookeville and that Friday night, I don't know why the date is leaving me right now, but the horrendous downpour that we had with a lot of flooding, with intersections flooded, and I'm sitting at home thinking, yeah, no big deal. I live on a hill. I'm not going anywhere, so hopefully everybody's okay with flash flooding, but it's not going to affect me. Oh, was I wrong? Our office, the drainage backed up, and basically everybody in our strip got their floors flooded. And so right now we've got dehumidifiers going and trying to get some cleanup done, but the dampness is there. Hopefully we're getting ahead of the process of mold, but it's been a mess. And but I didn't find out about it till Saturday, and maybe if I'd known something Friday night, I could have been a little more proactive on it and gotten things started a little sooner. But if you've ever experienced any kind of backup with flooding, it's a mess, and you've got to work on the preventing mold. They haven't torn the office apart yet, but it could happen. We could be down for several days. I don't know what to go there. But anyway, so back on the subject about one of the reasons that the thing about the age gap came up today, for me, for the subject for today, was talk to somebody recently, got a referral from a, great referral client. Say, hey, call Matt. He took good care of me with my insurance. The issue with this individual was he's, I think, 62, something like that, a couple more years before he goes on Medicare. His spouse, she decided to, well, I don't say decided, but she retired in February and went on Medicare, and he was covered on her employer insurance. Now, of course, I didn't have contact with them, but, I don't know why they didn't reach out to someone as myself. I mean, obviously, she probably talked to somebody about her Medicare. Most people don't just go and sign up for their Medicare on their own. They usually will talk to somebody, whether it's and this is, again, one of those times I'll harp on and preach on, don't call the 800 numbers. Because you talk to somebody on the 800 number, they're going to, and I say 800 number, you're just calling a call center, or you're not meeting with a local agent. Sometimes this happens with local agents too, but they're concerned with getting you your Medicare coverage and moving on to the next prospect. At Matt Libby Insurance, as we say, we don't sell you insurance policies. We match you with the coverage that fits you. If I'm working with somebody with Medicare and I find they're married, I'm asking them, what their spouse is doing for insurance. Do they need help with the insurance? Because we don't just do Medicare. We don't just do Affordable Care Act. We have several options. We have short-term plans. We have fixed benefit plans. We can do a hospitalization supplemental plan to cover, against, and I say hospitalization or cancer plans, those things that'll protect against the expense of a catastrophe, but you're still going to be out of pocket for your routine medical care. And so a lot of people think, I've got to have insurance so I don't have to pay a copay, or I don't have to pay $100, $150 when I go to the doctor. Well, you're not saving anything if you're paying $500 a month for your insurance to not pay $150 when you go to see a doctor. So if you think of it that way, you can cover against those more expensive things that could happen, like a heart attack, a stroke, diagnosed with cancer. All those kind of things could come up, and you've got some money to help cover those big expenses, but you're paying for the doctor visits. But the reason I brought that up is this individual that called me recently, he was on his spouse's insurance. She retired in February. Well, this is July. We're getting close to August. And you have 2 months, basically. Usually, it'll say 63 days because some months have 31 days. So they put in, you have 63 days to find replacement insurance and have a special enrollment period. It's more than 63 days since February. So, like I said, we're in July, so that's June, May. So sometime, towards the end of April would have been the latest to lose coverage and be able to have a special enrollment. So that's one of the big things that runs again. And to compound things, this gentleman has some back issues. He's actually applying for disability because of his back issues. I can't go with most of the alternatives I have for Affordable Care Act because of a back problem will knock you out of getting the plan. Because those plans are underwritten. I know a lot of times people think, wait a minute, nobody can turn you down for pre-existing condition anymore. And I think that's what gets people. They think, well, I'm not going to the doctor right now, so I'm not going to pay for insurance. I'll wait till I need to go to the doctor and then get a plan. You can't do that unless you have a special enrollment for like Affordable Care Act plan. And of course, income comes into play. I haven't talked about income with this individual, so I'm not sure. Obviously, he's not working, so he doesn't have any money coming in right now. I'm guessing his wife, when she retired, maybe she has a pension from her job, but she probably started her Social Security when she went ahead and retired and went on Medicare. But so I run into that a lot. And that's one of the things that come up. My notes here is, why are age gap couples, why are they different? Medicare, employer, Affordable Care Act milestones don't line up between the spouses. As I mentioned in this case, this gentleman, I believe, like I said, I think he told me he was 62. She's 65. He's not eligible for Medicare yet. Now, if he gets approved for his disability, and depending on when they award that, if they backdate it over 2 years or more, he'll immediately qualify for Medicare, but he doesn't have anything right now, so that's an issue there. And so we kind of refer to that as the orphan spouse, that your spouse is on your employer insurance. And that's why I really like to get with people that are looking at they don't look at the marketplace because they have insurance through their employer, but is that insurance affordable? Because a lot of people just look at, this is what our insurance costs, and actually most of that cost is going to be the spouse. Now, if you have, I say underage, but if you have children that, currently under the age of 26, they're eligible to be on your insurance. So that is something that you can do. But I've had a lot of couples and sometimes families that, because the cost of the employer plan was for the family members is so high, they still qualify to go to the healthcare marketplace. And kind of one of the ways I look at it is, are you offered insurance through your spouse's employer? Well, allowing you to sign up for the plan and charging you through the nose for it, to me, that's not offering insurance. If the employer isn't subsidizing the family's insurance at all, to me, and again, this is my opinion. I don't think, maybe it's not a good legal stance, but my opinion is that's not offering insurance. That's just, hey, you can join your spouse's plan because we offer them a plan, but you're going to pay through the nose for it. And the thing is, yes, you can get that plan without not having to go through underwriting. They have to accept you regardless of your pre-existing conditions, but you still have to deal with enrollment periods. So say your spouse gets offered insurance, and so they take the employer plan, and 2 or 3 months later they want to add their family to it. They're not going to be able to do that. They're going to have to wait for the open enrollment whenever that is. Employer open enrollments aren't always for January start date. Some plans they'll do open enrollment in April, and the plan starts on July 1st, or June 1st, or June. So it's not always tied to that annual election period like the Affordable Care Act is. You sign up in November or December for a January 1st start date. So those are some of the things there. So we also, the Medicare timing trap, you have IEP versus SEP. IEP is that window when you are first eligible for Medicare, and it's a 7-month window centered on your birth month, the month that you turn 65. You have the 3 months before, the birth month, and the 3 months after to sign up for Medicare and go ahead and get on a plan. So you have to make sure, and the other thing on that I've run into a couple times, again, this is not necessarily on the age gap issue, but when you're turning 65 is not the time, when it comes to insurance, that's not the time to be changing jobs. And the reason I bring that up is actually there was a forum in one of my agents groups we were talking about, and I had a similar situation happen with a client. And with the issue with my client was he changed job the month after he turned 65. And he had insurance there. We filled out his paperwork for him to start his Medicare, and Social Security goes, your client turned 65 the month before he took this job. So even though he was still in what's considered his IEP, he did not have continuous, according to what we had submitted, he didn't have proof of continuous coverage from when he turned 65 until he was applying now at 66, 67. It wasn't, and he didn't qualify for the Special Enrollment Period because it wasn't his IEP. And he was also looking to face the late enrollment penalty for Part B because it was over a year from that date. Now, fortunately, he did have insurance with his previous employer. We got the paperwork with that, and then everything got issued without being a problem. But it did hold things up because if he'd have had that 1 month gap, say if he had left that previous employer like the month before he turned 65 and then didn't get the other employment the month after he turned 65, he wouldn't have had that SEP. Because that's the confusing thing, and I don't know why they do it that way. They tell you have a 7-month window to enroll in Medicare, but because once you turn 65, if he'd have went ahead and went on Medicare in that initial period, he would have been okay. It wouldn't have been any penalties because he would have signed up during the window. But because he was delaying Part B, basically delaying enrolling in Medicare, period, he hadn't picked up Part A either, but delaying Part B because he went to an employer that had coverage, he didn't sign up for Medicare. Well, so that's where the penalty could have come into play, was because he didn't have continuous employer coverage since he turned 65. So it doesn't matter if you got the coverage during your IEP, he was showing on paper that he had a month gap. So that's kind of a little bit different situation. And you just notice we're up on the break here. I may kind of continue with that scenario and be right back.
New backpacks, new schedules. Maybe it's time for a new phone, too. Get gig speed internet starting at just $64.99 a month. Then switch to Tri-Lite Mobile and receive $600 toward a new phone or contract buyout on your first line, plus $400 toward every additional line after. That's serious savings for busy families. From the classroom to the carpool line, we've got your family covered. Call 800-644-8582 or visit twinlakes.net.
Requires Twin Lakes Internet and qualifying mobile plan. Bill credits applied over 36 months. Restrictions apply. See twinlakes.net for complete details.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back on Insurance Matchmaking. Before the break, I was talking about those potential gaps for when you go on employer coverage. I actually had met with somebody else recently that had come to me because he was turning 65 and had employer coverage, and was getting ready to leave the employer plan and go out in a private practice, but it was going to be a group that was going to have insurance. So I counseled him, make sure there's no gap from when you're leaving your employer plan to you pick up the plan that you have because you're turning 65. The other issue was his spouse was on his plan also and was already Medicare eligible. So I said, well, if you're going to have any gap in that coverage, we need to use that gap and get a special enrollment going for her to go ahead and get her Medicare in place and a Medicare plan in place, because that gap would put her in that penalty phase. So she could have insurance, but again, that penalty could come into play. So, they don't have to, but if they don't want a penalty, you need to go on Medicare. And also they were going to be running into the IRMA situation, so they maybe would delay it and say, well, since we'd have to pay IRMA, we're going to pay more in IRMA than we're going to pay in penalty if we wait a year. So, so there are different considerations. I haven't talked to him since the initial consult. I know that that move has come, but I don't know. And like I said, I counsel him that, hey, make sure that you don't have a gap. That when you leave that one employer plan, your new plan picks up immediately, so there's not a month gap in there. So hopefully they followed that advice. But we talk about that those age gaps. Like I said, it could be 10 to 20 years. Between the spouse, because a lot of times, because when the older spouse goes on Medicare, they were the one that had the employer plan, and so now the spouse has to do something different. So there are some options. COBRA is one of them. If you leave an employer group, you can use COBRA to continue that coverage, but that's only, usually I think it's usually up to 18 months. It's going to be expensive, and depending on whether you qualify for subsidy through the marketplace or not, it could be less than just going to the marketplace without subsidy. And then again, also, if the spouse is healthy, I do recommend consider a short-term plan or a fixed benefit plan. A few shows back, we talked about the medical expense shield, which combines those two together, it gives you at least 3 years of coverage. After that third year, you would have to go through underwriting again for the health plan portion of that. So may not qualify at that time, and then a marketplace plan may be an option. And then we, again, as I mentioned, we have those fixed benefit plans that you can just do that standalone or comprehensive care. And I think, was it last week? I think I talked about doing a index universal life and having chronic care, because it comes with a chronic or critical care rider, that you can take 80% of the death benefit and apply it to your health care. So that's something that could be a good gap filler. And again, I'm saying on that situation, if you're under 65, you maybe would go ahead and go to the marketplace and, again, be paying full price, but then you'd have a health plan, but you may need, something that covers your expenses until that open enrollment comes around again. So that's the biggest danger, I think, when you do like a fixed benefit plan or a short-term health plan, is when that plan ends, or when you would have to reapply for that plan and go through the underwriting, is probably sometimes going to be like mid-year. And if you do end up with a situation where you can't continue that plan, it doesn't give you a special enrollment for the marketplace. It's not creditable coverage as we use in the Medicare realm, but what they call a qualified health plan. The marketplace plan, you can have the same type of plans directly from a carrier. You don't necessarily have to go through the marketplace. You still have to have the valid enrollment period. That was part of the thing, was when they did that was people still, if they're going to get private insurance, you can't just get it at any time. And I think part of the education I'm trying to do here right now is a lot of people just think they can wait, and it's not a good idea. I'm not saying you can't wait, but it's not a good idea. Because of pre-existing conditions, you may be limited to what you can get, or you have to have the waiting period to be able to get on, say, a marketplace plan or a qualified health plan. That the big carriers, United, Blue Cross, Cigna, Ambetter, they have plans that are what we call off-exchange plans. They're basically the same as the plans you would get on the healthcare marketplace, but you don't have to go through the healthcare marketplace to get them. But they still follow the same criteria. They have to cover dental and vision for children. They have to be guaranteed issue. You can't turn down for pre-existing condition, but they're still going to be expensive, just like the market plans on the marketplace are going to be expensive if you don't get the tax credit that subsidizes that monthly premium. So we have to be mindful of those enrollment periods. If you're losing coverage, your spouse is changing. But anything, I was saying, if you talk to a lot of people, they'll talk to somebody that just does Medicare, and they don't ask them about their spouse, or they say, "Well, I don't do that," and so it just kind of gets pushed aside. Versus when I meet with a couple that one's going on Medicare and the other one, I make sure that they have something. Sometimes it's just a matter of maybe they're both on the healthcare marketplace, so a lot of times it's just a matter of once the older spouse goes on Medicare, is contacting the marketplace and saying, "Hey, my spouse is on Medicare now," and they redo the paperwork. And this is the crazy thing there is that they're getting the subsidy for the marketplace, especially if there's a big age difference. The insurance generally goes, the monthly cost generally goes up when that spouse goes on Medicare. It doesn't go down. You think, oh, she cut in half. And it actually the opposite happens. It usually increases. It doesn't double, but it increases because the way the formula works for crediting the tax credit is based on a couple. And it's still based on household size, but it also takes into consideration how many members of the household are going on the insurance plan. So that difference in subsidy usually increases it for that, I almost said surviving spouse, that remaining spouse that stays on that plan. So, and I know I've said that on past shows, but I try to make sure people, especially my clients, know it's like, hey, don't expect your insurance to go down because Joe's going on Medicare. Mary, your plan's probably going to go up. And those are just hypothetical names, not anybody particular. Not that I don't have Joes and Marys for clients, but I wasn't talking about a specific couple. So that's what can happen in those coverage gap years. So the other thing is, veterans and second marriage nuances. Maybe you have an ex-spouse. You're not covering the ex-spouse anymore, but you may have children that you're covering. You may have VA. Now, one of the things with VA is someone who has a rating of 100% disability from the VA, their spouse would qualify for what's called CHAMPVA. And so it works very similar to TRICARE, which is for folks like myself who did and I say 20 years. You don't necessarily have to do 20 because there were some early retirements. But if you are eligible for a military retirement, then you have TRICARE, and your family members, and your minor children can be on your TRICARE plan. Now, you don't lose that when you go on Medicare. So that plan, you're able to continue. But a lot of other retiree plans, again, are that you may be on a retiree plan and then you turn 65, they don't cover your spouse anymore. I do have some people come in that way that, their spouse is going on Medicare, and now they have. What's frustrating for me is I get people coming to me for their health insurance, but they'd already taken care of their Medicare. It's kind of like, no, I need to take care of your Medicare and then help the spouse. But because kind of as I've alluded to earlier is I'm cleaning up somebody else's mess because they didn't take care of the spouse when they did the person's Medicare. TRICARE is a little bit different. Like I said, it's a different situation. That spouse, around here we have what's called TRICARE Select. There is TRICARE Prime where you're paying, a premium for that. You continue to pay the premium to keep your family member on there, but they don't lose their coverage because you went on it. So you're probably still paying the same premium for that. And of course, with TRICARE, you do have to pay for Part B of Medicare to get what's called TRICARE for Life. So I do work with those kind of cases. The good news is, again, to let people know, hey, you're still going to have your TRICARE. Just make sure you continue to pay that premium. I don't have to do something with that younger spouse's insurance, at least for them to have their major medical coverage. But one of the other things before I run out of time is a lot of people are just, it's time to do something. It's time to pick a plan. And what I'm trying to address here is let's do a little bit of planning. One of the things I hadn't touched on yet, but because your timelines are different, we need to prepare for both those timelines and Generally, when we're talking to people for Medicare, we're usually looking about 6 months before they're eligible for Medicare. But if you would like to kind of explore your options, maybe you're 1 or 2 years out of one going on Medicare, again, like I said, it may make sense to go ahead and get the younger spouse off the employer plan and onto a marketplace plan. And that way, when the spouse retires and goes on Medicare and they drop their employer plan, it's just they're dropping it for them. So those are some scenarios that can make sense, that maybe you want to make a change in how each of you get your insurance prior to the older spouse turning 65. The other thing is what we call IRMA. I've talked about that, the income-related monthly adjustment amount. That income does make a difference. Like that's why I mentioned a little bit with the one with the changing, leaving an employer but going out on a private group, is the income. That IRMA income can put you where you're paying extra on your Part B premium, and it also includes your Part D premium. That also has a IRMA surcharge. So if you got one spouse that's still working, maybe the younger spouse was the one you were using the group insurance for, it still may be, that's one of the things we do, a cost benefit analysis, and determine, does it make sense to go ahead and go on Medicare or stay on that employer plan. Staying on Marketplace is not going to work, because Marketplace, you're not eligible for the subsidy. Now, once you're on Medicare, now I guess if you're not getting the subsidy, but then the cost benefit, I think, is even with IRMA, you're going to be paying more to be on the Marketplace than paying IRMA. So that I don't think is so much a consideration. Group plan, where it's subsidized, yes, it may make sense. The Social Security looks back 2 years to assess that IRMA penalty, because what they do is when you're getting ready to apply, that's usually the last tax year that taxes were filed. So like right now in 26, they're looking at the 2024 taxes. Well, granted, we're past the 2025 tax filing, but they still go back to the 24 one to assess whether you have IRMA or not. And in the next year, January, they'll have your 25 tax return. And that's another reason to make sure you get your taxes filed on a timely manner, because it could affect whether you have that IRMA charge or not, especially if you get IRMA. If you got IRMA assessed because in 2024 you could be over that amount. And I just looked at the clock. I'm actually out of time. So keep listening to us here at Insurance Matchmaking and on Saturdays at 10 on Grace 107.7, and we'll talk to you again next week. If you got questions about what I covered today, please reach out.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.